Hello, I'm Dulasha Kavindi from Group 8 and this video will be about disorders of the integumentary system. So I will be telling you guys about the signs and symptoms that you should immediately report to the nurse. Signs and symptoms of skin disorders that if you observe in a patient. So when you take care of the integumentary system of a patient, the unusual signs and symptoms can be realized just merely by observing the skin. It is not like neurological disorders or signs and symptoms or anything, but still the best course of action is to actually ask the patient questions. For example, how have you been feeling? Have you noticed any changes or any unusual things if the patient is conscious? But in the case of an unconscious patient, you will have to observe thoroughly and then report. So for example, when you're observing the skin of a patient, you might want to look for signs and symptoms such as discolored skin patches, that is abnormal pigmentation on the patient's skin, dry skin, open sores, lesions or ulcers which probably will lead to a serious disease, peeling skin, rashes with itchiness or pain, red, white or pus-filled bumps on the skin, scaly and rough skin, etc. So the best thing is to ask the patient questions, but if you can't, you will have to observe and then tell, because if these signs and symptoms are recognized in the early stages, it will be very easy to prevent the diseases. So these signs and symptoms can mean any disease, ranging from simple disorders like acne to more serious life-threatening ones like skin cancer. So different skin disorders include alopecia, dermatitis, pemphigus, psoriasis, rosacea, scleroderma, and many more.